Professional guidance for psychologists in preventing and addressing sexual abuse. While most psychologists acknowledge that boundaries are essential to professional practice, there are some known faulty beliefs about sexual boundary violations held by certain healthcare professionals. Knowing these faulty beliefs is important to protecting clients and informing psychologists. Although there is no definitive, predictive, or causal research available at this time regarding clinical characteristics and sexual boundary violations, there are self-report, case study, and archival methods that have identified factors for psychologists to monitor in their own practice. As well, there are client considerations that psychologists must acknowledge and over the course of psychological services. Even when psychologists strive to establish clear professional boundaries, clients themselves may confuse or attempt to blur boundaries. Maintaining boundaries by responding in a professional way is essential, and always the responsibility of the psychologist. Here are some actions psychologists could consider for themselves when encountering boundary issues. Seek consultation from a colleague. Engage in a formal ethical decision-making process, and reflect on their own behavior or feelings. These actions may be directed towards the client, educating the client on boundaries, normalizing their feelings while providing redirection. Supervisors play an essential role in helping their students or supervisees understand, establish, problem-solve, and manage professional boundaries, including preventing sexual abuse and misconduct. Healthcare patients may report to another practitioner that they have been sexually involved with a previous therapist. Psychologists should be prepared to address disclosures to offer clients appropriate support and information. Psychologists need the necessary knowledge of their duty to report obligations regarding sexual abuse or misconduct by a regulated health professional. These have expanded under the 2019 HPA amendments and need to be discussed with clients as a limit to confidentiality. In closing, ongoing mindfulness of the process for establishing and maintaining professional boundaries is essential for psychologists to fulfill their obligation to prevent and respond to potential boundary violations, particularly of a sexual nature.